Good evening or good afternoon to everyone joining online. We will just give a couple minutes for everybody to sign in before we get started. I will just direct your attention to the slide on the screen. So just a couple notes, this webinar will be recorded. For the duration of the session, your microphone and camera will be turned off. And for accessibility, we have enabled live captions, so you can turn those on from the Zoom control panel on your screen. Again, so good evening to everyone who's currently logging on. We will get started in just a couple moments. And just to direct everyone's attention to the slide on the screen, just a reminder that this webinar will be recorded. However, your microphone and camera will be turned off for the duration of the session. And if desired, you can turn on live captions. These can be enabled from the Zoom control panel at the bottom of your screen. And we will get started in just another moment here. Okay, so good evening or good afternoon, depending where you are. Welcome to tonight's webinar, which is Spotlights on Students, EIDM Resources to Prepare You for Your Public Health Career. My name is Alana Miller, and I am a research coordinator at the National Collaborating Center for Methods and Tools. I will be facilitating tonight's session. And later in the session, we will also be joined by three panelists who will provide their perspectives on their MPH academic journeys and their career journeys. So just a couple housekeeping items before we get started. Um, if you're experiencing any technical issues, please indicate so in the Q&A. We have disabled the chat for this session, but you can still connect with us via the Q&A, and either myself or Krishan will be able to help you with any of your technical issues. Throughout the session, if you do have any questions, please feel free to add those to the Q&A, and we will address them when we get to the designated Q&A session at the end of the webinar. And lastly, we have a couple polling questions that we will be running throughout the webinar. So we do ask that when those pop up on your screen, you answer them. And it helps to provide some really valuable feedback to us that we can use to improve future webinar sessions. After today, you will be able to access the webinar recording. So as I mentioned, this webinar is being recorded. It will be available in English at our YouTube channel, which is the link is provided there on the screen. Typically, we are able to get the video up in about a week or so after this session. And if you're interested in accessing the slides, you can email us at the address on the screen, and we are more than happy to share the slide deck with you if you desire. If you follow us on LinkedIn, we will let you know when the webinar recording is available, and you can access it on our YouTube channel. So the NCCMT is funded by the Public Health Agency of Canada, and we are affiliated with McMaster University. Production of this webinar has been made possible through a financial contribution from the Public Health Agency of Canada, and the views expressed here do not necessarily reflect the views of the Public Health Agency of Canada. I would also like to acknowledge that McMaster University is located on the traditional territories of the Mississauga and Haudenosaunee Nations and within the lands protected by the Dish with One Spoon Wampum Agreement. Some of you may be familiar with the Dish with One Spoon Wampum Agreement. It basically states it was originally a peace treaty that was enacted by the Anishinaabe and Haudenosaunee nations hundreds of years ago, and it's used to describe how the land can be of mutual benefit to all that inhabited it. The dish represents the land that is to be shared, and the spoon represents the collective individuals that live on the land and use its resources. So for today's session, we're going to start with a bit of an introduction to the National Collaborating Centers for Public Health and the National Collaborating Center for Methods and Tools. And then we will move on to talk about what is evidence-informed decision making and what that looks like in public health. I will guide you to some resources that you can use in your academic careers or in your public health careers that can help to support EIDM in public health practice. And then for the latter half of the session, we will be joined by our panelists who will answer some questions, and you will all have the opportunity to ask them some questions as well. In terms of learning objectives, by the end of the day, you should be able to define what evidence-informed decision making is and understand its value in public health. You'll be able to identify tools and resources that you can use to apply EIDM in practice. And lastly, we hope that you can appreciate the perspectives of public health graduate students on evidence-informed decision making in public health. So before we get started with webinar content, we are going to launch our first webinar poll. So I will get Krishan to launch that now. Basically just interested in, have you heard of the NCCMT before, or have you been to our website? And if you have, how many times have you done so? Okay, and it looks like a lot of people actually have been to our website before or have used our tools. So that is really great to see. So thank you for everyone who responded. Moving along. So the National Collaborating Centers for Public Health were funded in 2005 by the Public Health Agency of Canada in response to the 2003 SARS epidemic that was here in Ontario. And the collaborating centers were established to work together to promote the use of scientific research and other types of knowledge in order to strengthen public health practice programs and policies throughout Canada. There are 6 different centers that each have a different focus. So that there is the National Collaborating Center for Indigenous Health, located in British Columbia, along with the National Collaborating Center for Environmental Health. We have the National Collaborating Center for Infectious Diseases in Winnipeg, the NCC for Methods and Tools, so our center located here in Hamilton, Ontario. There is the NCC for Healthy Public Policy in Montreal, and then in Nova Scotia, there is the NCC for the Determinants of Health. If any of those focuses kind of speak to you and you're interested in learning more about the resources available, I definitely encourage you to check out their websites, or you can check out the NCCPH website for additional resources about all of the different centers. So here at NCCMT, we focus on methods and tools for evidence-informed decision making, specifically resources that are geared towards curating evidence, building competence, and accelerating change within evidence-informed decision making. Later in this session, we will actually talk about some of these specific resources, but essentially what our goal is to facilitate and scale EIDM in public health organizations across Canada. And we do so by providing high quality resources, real world training, such as this session, and practical mentorship that can respond to the evolving needs of the public health community. And our goal, similar to all the other NCCs, is to advance a stronger public health that is driven by the best available evidence in order to improve the health of everybody living in Canada. So I have been saying evidence-informed decision making at least 25 times at this point, but what exactly do we mean by evidence-informed decision making in public health? EIDM is essentially the process of distilling and disseminating the best available evidence from research context and experience, and then using that information to inform and improve public health practice. Essentially, it is just finding, using, and sharing what works in public health. And we'll talk a little bit more about what this actually looks like. So, first and foremost, when we're talking about evidence-informed decision making, we need to discuss what is evidence. So, simply put, evidence is basically any collection of information that supports that something is true. But when we're talking about public health evidence, we're looking at really four different types. And here we have our model for evidence informed decision making that kind of goes over what the different types of evidence are. So, starting with what most people think of when they think of evidence is research. So, research falls into the purple bubble, and this includes qualitative or quantitative research that is often seen in the form of peer reviewed academic publication. It could also be lots of form of gray literature. But this is often what people think of when they hear the term evidence is they think of what does the research say? However, there's other different types of research that are equally as important to consider when you're making decisions in public health. The second type is local health issues and local context. So this is our yellow bubble. And this includes things like surveillance data or community health status reports. But this is essentially what is going on within your community. Another type of evidence is community and political preferences and actions, and this is um, basically what are the opinions of the people within your community, including political actors. You can gather these types of evidence from newspaper stories or running focus groups or interviews with people who exist within your community. And the last type of evidence that we'll talk about are resources. And it's challenging to think of resources as a type of evidence, but essentially what this is within your public health community, what are the financial or human resources you have available? So, what is the budget? What type of people do you have to work? And what are the skill sets of those people that you have to work with? So this is our model for the different types of evidence that can be used for decision making in public health. And these types of evidence should be brought together with your public health expertise in order to make a decision. So if we think about these types of evidence with a scenario, this is maybe how we could, within one specific topic, pull evidence from these different bubbles in order to make a decision. So if our scenario is looking at active school transport, so let's say this has been identified as a priority in our region, and we've been asked to develop a plan to promote active school transit within our elementary school age children. We may want to start first to look at that yellow bubble and think, what is the local health issue around public active school transit, and what is that context? So we may want to look at things like how many children are currently walking or biking or using some form of active transit to get to school, and also look at how many of those children are within walking and biking distance to schools. And that way we can determine, do we really have a problem? Do we have a very low proportion of children who are engaging in active school transit? And from there, we can really work at defining what our problem is. Once we've looked at the local health issue, we may want to turn to that purple bubble to look at the research evidence to determine what are effective interventions that could help to improve active school transit. And from there, you may find studies that say improving the built environment around those neighborhoods is effective. So, adding more bike lanes or adding more sidewalks to these neighborhoods. Or maybe it's that, children don't have proper supervision and so they are unable to walk to school safely. So maybe we need to add more crossing guards, or maybe we need to do something like school bus groups that kids can bus all or kids can bike all together to get to school to help with those supervision issues. We may then need to ask about community and political preferences. So we may have an intervention that works, but how do the parents feel about their kids walking or biking to school? And what about the school staff? Do the school staff feel comfortable with the children, and are they able to provide support um, to such programs? And then finally, go back here. We may also need to think about, depending on what our intervention is, are we able to do this financially? If we need to add sidewalks or bike lanes, how much is that going to cost and is that feasible? Or if we need to hire more crossing guards, is that within our budget? Are we able to do these types of things to get the intervention off the ground? So, here with this example, you can kind of see how you can pull information from several different types of evidence in order to inform that public health decision making. So here is our second model for evidence-informed public health, and this might be something you have seen before, but this is the stages or the process of actually doing evidence-informed public health. And we typically start at the top of that seven-step wheel with the define stage, and here is where we really define what is that question that we need to tackle. Often this means you're looking at that yellow bubble of evidence, but here is when you want to come up with a focused practice question that you are trying to answer throughout the rest of your process. After you've defined your question, you move on to the searching stage, which is when you start to gather your evidence. If we're talking about the purple bubble, so where we are looking at research evidence, here's where you would work with a librarian to do those database searches to see what types of research evidence you can find. No matter what type of evidence you have gathered, whether it be from the purple bubble or the green or the yellow or the red, the next step is you need to appraise that evidence. So not all evidence is created equal. The next step is to consider all of the evidence you have and appraise it to know which evidence you can trust and which evidence you cannot. Once you've appraised your evidence, you want to pull it all together, and that happens during the synthesize step. So during the synthesize step, you will pull together all of the information that you have gathered and that will be what is used to help inform the decision for whether or not you are implementing a new program or stopping something. After synthesize, if it is decided that you will go ahead and implement something, the next step that you are going to do is adapt that program. So it's unlikely that you have found enough evidence within your own community to support that something is going to work. So you need to make some adaptations from the evidence that you did find in order for you to feel confident that it will work within your community. Once you have made those necessary adaptations, the next step is to actually implement. So here's the fun part. We are actually going to do what we said we are going to do. And implement within itself consists of several different steps. But here is the part where you're actually going to put into action your program or policy. And after you have implemented, the final step is to evaluate. So you want to know, did I do what I said I was going to do? And did it work? So you want to evaluate that program or policy to make sure that you did, in fact, answer that question that you had initially defined at that first stage. And then the cycle just continues on again from there. So, very quickly, those are the stages and processes of evidence informed public health. And we have several different resources that can go into these stages a little bit more in depth that we will talk about in a little bit. So, why evidence informed decision making? Why is this important? Well, several reasons. The first is reducing harms. So, whenever public health implements any program of any kind, there's always the risk that there will be unintended consequences. This can happen with anything. However, if we use an evidence-informed approach and we're looking to see what has been done in the past and what has been done successfully, hopefully we're able to recognize when harms have been caused, and we can take the necessary actions to prevent those from happening in the first place. Obviously, of course, we also want to improve health outcomes. So when we're picking an intervention, we want to look at the evidence to see what is most effective, what is going to have the biggest impact on our community in order to improve outcomes. We also want to improve satisfaction. So not only is it important for the health of our community to improve, but we want to make sure that this is an intervention that the community supports, and that the community is happy with us providing. And then lastly, of course, we need to maximize resources. So public health is often working with a already strained budget. And if we need to improve health outcomes in our community, we need to make sure that we're doing so in a way that is financially beneficial to the organization. So we need to be smart with how we spend our money. And essentially, it's all about getting the most bang for your buck. So, how can we improve our health as much as possible in the most economically friendly way? So, that is our quick little introduction to what evidence informed decision making is. Um, As I said before, NCCMT's purpose is to provide resources to support evidence informed decision making. And we have several different training resources and knowledge repositories, as well as tools that are helpful for students to learn evidence informed decision making skills and then. And then to help transform those skills from the classroom into practice once you all start your public health careers. So a few resources that I did want to highlight. One includes the Learning Needs Assessment tool. So if you are new to NCCMT or you haven't checked out our website before, this is definitely a great place to start. This is a 20 multiple choice question quiz that can be used to assess your learning needs with regards to evidence-informed decision making. So there's 20 different questions, they're multiple choice, and they each correspond to those 7 different steps in the wheel that I just went over. Once you've taken the assessment, it will give you a personalized report so you can see how well you performed in each of those 7 steps. And if there were some steps that you maybe struggled with, it will provide resources that you can use to help improve your skills in those steps. So, one such resource that you might be directed to is our online learning modules. Some of you may be familiar with these if you have completed some of the modules as part of your curriculum, but these are a series of interactive, problem based online learning modules that are free for everybody to access. We have modules that help to address all 7 of the steps in the EIDM process wheel. It says they take about 2 to 3 hours to complete, but I would say probably closer to 1 or 2. And they're easy to access, they're free to access, and they are a really good place for you to start to learn some of those basic skills of evidence informed decision making. And Krishan is adding all of these links in the chat, so it's easy for you to access. Another really good training resource is our Understanding Research Evidence video series. So, if any of you are taking biostats this semester and are finding it challenging, I will encourage you to check out this resource. This is a series of short videos we have that teach about statistical concepts in public health. So, videos on odds ratios and relative risks and standardized mean difference and how to read a confidence interval and how to read a forest plot, and all of those things that can be a little bit challenging when you're taking biostats. Each of these videos, they're short, they're animated, and they use real public health examples. So they can be a good resource or a good refresher if you're learning about biostats in school. A couple knowledge repositories I do want to point out that are a good resource and something good to keep in the back of your mind when you transition into the public health workforce. So the first is our Registry of Methods and Tools for Evidence-Informed Decision Making. This was kind of our inaugural resource here at NCCMT. This is really what we started with. And it is a collection of curated resources that can be used to support EIDM in practice. So each of the resources corresponds to a different step in the EIDM process wheel. We've tried to make it easy to search, and you can filter the resources as needed to find templates, or if you're looking for a resource that's available in French or comes with an example, you can find something that is super useful to your needs. I think there's currently maybe over 200, I think around 220 resources in this, and we are continually updating it. So you can always find what is most relevant, most timely, and most practical for those working in public health. Another knowledge repository I want to point out is health evidence. So, health evidence is a database of quality rated systematic reviews that evaluate the effectiveness or the cost effectiveness of different public health interventions. We currently have over 10,000 reviews in there. So, if you're ever looking for research evidence, so that purple bubble that corresponds to um, if you're looking for evidence on the effectiveness of a different public health intervention or policy, this is a really great place for you to start so you can identify um, different systematic reviews that will help to address those questions. A tool that I want to draw everyone's attention to is our algorithm for classifying the study design of primary studies. So, for those of you taking epidemiology or research methods this semester, you may have had to identify different study designs. We have a tool that can help with that. It is an interactive algorithm, so it will ask you a series of questions about a study that you are reading. And at the end, hopefully, it will be able to tell you whether it was a descriptive study, observational, experimental, and it will tell you what study design that study is. And then another tool I will direct your attention to is the Health Evidence Quality Assessment tool. So I'm sure many of you are learning about quality appraisal in your class. Health Evidence has its own quality assessment tool that we use to assess all of the systematic reviews included in the Health Evidence database. However, the tool itself is also available for you to download and use for other systematic reviews. It was developed in collaboration with real public health professionals, and the thought is that this is a tool designed by public health and should be used by public health practitioners in public health practice. So it's easy to use and it's applicable to public health relevant studies. And last but not least, our rapid review guidebook. So some of you may have the opportunity to complete a rapid review as part of your curriculum in your MPH program. If you are doing so, the rapid review guidebook may be a really great place for you to check out. It details each step in the rapid review process and provides notes on how to tailor the process given certain resource limitations. Um, this is the same methodology that the NCCMT uses to complete our rapid reviews, and it's a really great guide if this is something that's new to you. So without further ado, I am going to invite our panelists to join us. So we are lucky enough to have three panelists joining today. First is Sophia Caldwell. Sophia is a research assistant here at the NCCMT. In addition to a Bachelor of Science in Biological Science from the University of Guelph, Sophia also holds a Master of Public Health degree from Brock University, where she graduated in 2024. So we're happy to have Sophia here with us today. We're also joined by Krishan Camargo, who is also a research assistant here at NCCMT. She received a Bachelor of Science in Health Studies from the University of Waterloo and then got her Master's of Public Health degree from McMaster University, where she graduated in 22. And lastly, we have Harsarat Saini, who is a second year MPH program at McMaster. And before that, she completed her Honors Bachelor of Science at the University of Toronto, where she specialized in health and disease and minored in immunology. So I'm so happy to be joined by the three of you this evening. What we have planned for the rest of this session is we have a series of questions that our panelists are going to answer, and I encourage all of you to also add your questions to the Q&A that we can address at the end. So the first question I'm going to have our panelists answer is, please share a little bit about your academic and career journey in public health. And I will get Krishan if you want to start.
Hi, hello everyone. My name is Krishan. As Elena had mentioned, I completed my bachelor's degree in health studies at the University of Waterloo. I was part of the co-op program there, where I mostly did research assistant or program assistant roles at the university. And then throughout my undergrad, I developed an interest in public health. And that's what led me to do my Master of Public Health at McMaster University. And we had the choice of doing either a thesis or a practicum option, and I chose to do a practicum, which was at Toronto Public Health as a research trainee. I completed my practicum in the summer of 2022, so still COVID times, and I was part of the COVID-19 planning team there, specifically the Strategic Assessment, Response, and Recovery team. And then throughout, I'd say like the second half of my MPH degree, I also was involved in community engaged research through the McMaster Research Shop. After I finished my MPH, that's when I started working at the NCCMT as a research assistant, and it's where I am now.
Thanks, Krishan. Harsarat, I will pass it over to you.
Hi everyone, so my name is Harsirat, and like Alana said, I am a second year MPH student at McMaster University. And before that, I did my undergrad at the University of Toronto, where I specialized in health and disease and did a minor in immunology. So I actually did a course in epi during my undergrad, which sort of like led to me to apply to this program. And so I actually recently completed a joint summer practicum placement with NCCMT, which was more like research focused. And I also did another practicum placement with the Hamilton Public Health Services, where I basically assessed their current transit programs to identify any gaps in terms of like equity and accessibility. And then right now, I'm also doing two different practicum placements. One is with Evidence Foundation, where I'm involved in different research projects. And the other one is with the Windsor Essex County Health Unit, where I'm basically helping with developing a food insecurity tool. And yeah, I'm super excited to be here and share my experiences as an MPH student.
Thank you. And Sophia, I'll have you answer the question as well.
Hi everyone. Yeah, as Alana mentioned, I did my undergrad at University of Guelph, which is when the pandemic hit for me. So from that, I ended up getting a short-term job at Public Health Ontario, where I was just packing COVID testing kits for health organizations. And then from there, I ended up working as a communications coordinator for the comm side of Public Health Ontario, which is where I kind of gained interest in the public health field. And then I went on to do my Master's of Public Health at Brock University. And then, yeah, did the practicum option and ended up doing my practicum here at the NCCMT.
Thanks, Sophia. Our next question is, how are EIDM skills important in your studies or work and within the public health field? And Harsarat, I will have you answer first.
Um, I think one of the main ways I've used EITM skills is through like doing critical appraisals. So for one of my first year MPH courses, we had to like critically appraise different types of studies, so like RCTs and like cross-section studies, and basically assess how like strong or reliable the evidence was. And I think that experience really helped me learn how to like tell the difference between like strong and weak evidence. And then also for my practicum at NCCMT, I sort of like use the same critical appraisal approach to like review studies before they were added to the health evidence database. And I feel like even though I'm not really using these skills daily in my current roles, I do think just that the foundational understanding of like how to evaluate research has really like helped me think more critically about what makes evidence strong to like guide public health decisions.
Yeah, thank you for that input. As someone who does quite a bit of quality assessment in my role, um, you quickly gain kind of the skill in identifying what is good evidence versus what is bad. And it's sometimes shocking to see how much bad evidence is actually out there. And it's important if you're using it to make decision making to be able to distinguish between what is good and what isn't. So thank you. Sophia, do you have anything to add?
Yeah, just going off of what Harsharat said, they're definitely just the foundation of any effective and efficient decision making, especially in a field like public health, where you will probably find most of the time there's not a lot of resources and not a lot of time. So you really have to use those EIDM skills to narrow in on the most informed, sorry, course of action. Um, and then specifically for me on the more kind of research side of things, same as Harsrat, the quality appraisal tools are really useful for me um, in things like our rapid evidence service, where we're creating rapid reviews with strict deadlines using quality appraisal, knowledge translation, and synthesis skills. Those are all really useful.
Thanks, Sophia. And Krishan, how would you address this question?
I might be echoing a little bit of what Harsarat and Sophia already said. I think back to my practicum, a few of my tasks were about like gathering evidence on public health interventions. So specific topics were like COVID-19 vaccines for very young children, different risk communication tools, and other population level interventions to mitigate the spread of COVID-19. So it's kind of happening at a time when there was a lot of research being put out about COVID and a lot of uncertainty about the evidence. So I felt it was important to have or like to know where to look for evidence. And I'm thinking back to that model that you showed, Elena, with the different bubbles. So, on one hand, yeah, you could look at research databases, but I found it was also important to look at what other public health units were doing in Ontario, across Canada, and other countries. And then also looking at the local context, like data being collected by Toronto Public Health, what epidemiology is telling us about the case rates and stuff like that. That was pretty important to know about, not just to look at research, but also to look at your local context. And then similar to what Sophia and Professor have said, it's important to know how to look for evidence. Just keeping in mind that, when evidence is fresh, it's not always appraised for quality. So trying to find the best available evidence within a short period of time. And then for me, what became challenging was, I have all these different pieces, but how do I communicate that to decision makers who are very busy and who need to be able to, take in all this information in a short period of time. And for me, that was learning how to communicate in briefing notes or how to write it in a way that it's concise and easy to scan. And I found there was a lot of preference for like bullet points of key takeaways whenever I wrote something. So I think it was also a skill to be able to condense that information and find what the key takeaways are.
Thank you for that perspective, Krishan. I know with doing workshops with a lot of people in public health, it is that synthesizing evidence and presenting it to a decision maker that seems to be a challenge for a lot of folks. So if you can learn skills in it now, it will definitely be beneficial for you once you transition into the workforce. My next question is, what's an EIDM resource that you have found useful, whether it be for school or within work? And Sophia, I will have you answer first.
Yeah, so a tool that I really like that I haven't actually used in practice that we have at the NCCMT is our case tools, um, which is QACE, which are a quality assessment tool more for the policy side of public health, um, which help you to kind of ensure that your evidence can influence the decision or change that you want to happen. Um, and I just really like it's really based off our bubble model that we saw earlier and really focuses on the green and yellow bubbles, which are kind of those like non-traditional types of evidence that you typically think of when you think of evidence. Um, and then a tool that I do actually personally use a lot is our health evidence quality assessment tool, which is a quality assessment checklist. I think this checklist specifically is really useful because it is more tailored to the public health side of research, which I find with a lot of the other quality assessment tools out there are much more tailored to kind of the more medical research side of things. So it's sometimes hard to accurately assess your research. So using this tool for public health research is really useful.
Thanks, Sophia. Krishan, what are your thoughts?
So I thought of this more from human resource side of things. So I found speaking to librarians being super useful because they know where to find things and they're very familiar with different databases and how to use them. During my practicum, there was a librarian at the Toronto Public Health who actually sent a weekly list of like new evidence on public health interventions. And that helped me feel confident that I was staying on top of new research coming out. And I've also spoken to librarians for like school projects, especially types of rapid reviews or systematic reviews. I've come to them with just like my research question and these are the keywords that I thought of, and they were able to point me towards specific databases to search and how to combine different keywords to find kind of information that I was looking for.
Thanks, Krishan. And Harsarat, what's an EIDM resource that you have found useful?
For me, I would definitely say the CASP checklist has been like one of the most useful resources for me. Like I mentioned earlier, for like one of my MPH courses, we had to like critically appraise different types of studies. And to do that, we use the CASP checklist to sort of like guide us through that critical appraisal process. And this checklist is basically like a series of questions that can help you assess how reliable a specific study is. I really liked how like clear and easy to follow it was, especially when you're like still learning how to think critically about like research design and bias. Another great one is the risk of bias tool, which I will actually be using soon for a system review project that I'm working on. Again, like it's basically a way to like look at how different types of biases, like selection bias or measurement bias, might like influence the results of a study. So I think that both are essential resources for like anyone who's like involved in like evidence synthesis in general, because they really help us to ensure that we're not just like summarizing the evidence, but we're also like evaluating the trustworthiness of evidence.
Thank you. And I'm glad you brought up the CASP checklist. So CASP, CASP stands for the Critical Appraisal Skills Program. These are really great tools if critical appraisal is new for you. They are meant to help build those skills of critically assessing evidence. And there are tools for every different study design. So if you are new to critical appraisal, that is a really good place to start. And I believe that we do reference these tools in our critical appraisal modules. These are the ones that we do recommend people get started with if they are new with critical appraisal. So thank you all for sharing those responses. We're going to shift gears slightly, and I would love if you could share your experience applying for and completing your MPH practicums. Parsarat, I will start with you.
Sure. So I actually found my practicum placements through the postings I've like posted on McMaster's internal dashboard. So that's like how I got my summer and my current practicum placements. So I didn't really have to like do too much work. But I do know like some of my classmates like did something different. So like some of them reach out directly to like supervisors they're interested in working with. And I think others like also found positions through like public health organizations like the Canadian Public Health Association and like the Public Health Ontario's job postings. So I think there's like definitely more than like one way to find a practicum that really like aligns with their interests. So I think it's like all about like exploring and like reaching out to the people you really want to work with.
Thank you. Sophia, would you like to share?
Yes, sort of a similar experience. I started off at least applying through Brock's internal portal where they put all the open practicum placements. I was having no success there, so I started reaching out just on my own, literally wherever I could, emailing organizations, even if they didn't have a job posting up, just to see if there was anything. And that's kind of how it happened with the NCCMT. I just emailed my resume, and they ended up having an opening at that time. And my experience was obviously awesome because I am still here today. Um, it was really involved in our rapid evidence service, which was a really good way for me to apply all of my MPH learnings.
Thanks, Sophia. And Krishan, could you share a little bit about your practicum experience?
Yeah, so I kind of did both approaches that have been mentioned. So Parsarat mentioned that McMaster had like an internal dashboard where they list all the practicum opportunities. So I went there. And I also made a list of different organizations that I was interested in, and I found their job board links and I bookmarked them into my browser, and I would just check them regularly for new postings. And as an aside, I actually found this super helpful for my actual job search after finishing my MPH. So if you could get ahead of that now, it's helpful in the future. But yeah, at the time that I was looking for a practicum placement, I mostly had experience doing research in academic settings, and I really wanted to get that experience working in local public health. So most of my like focus was at public health units in the GTA where I was located. So Toronto Public Health was on the list provided by my program, and then I just clicked through and applied through the City of Toronto's website. And the position was part of the summer internship program that they were running, which was structured more like a co-op job. And so there was actually a bit of a miscommunication when I started because I found out that their practicum placements were structured a little bit differently from this internship that I had gotten. But luckily, I was able to talk to my program director to make sure that I was still meeting the practicum requirements through this role. So really my advice is there are different ways to find things. Just make sure during the interview that this is for a practicum placement and that a supervisor can fill out the necessary forms and assessments for you.
Thank you, Krishan, for sharing. There's definitely many ways that you can go about finding a practicum, but it sounds like a good place to start is looking at your internal job posting boards to see what is available directly to students within your program. But yeah, definitely don't be afraid to reach out to organizations, especially if you have an interest in what that organization is doing and you have a passion for their work. Oftentimes, places are really willing to develop a project specific for you if you can demonstrate that that's something that you're really interested in. Okay, and then our last planned question is, what was your biggest takeaway from your MPH experience? Krishan, I will have you start.
Yeah, for me, my biggest takeaway was that it's a great time to build connections with public health. So I think one of the nice things that we had was that we would often have guest lectures in our courses, and I found those were opportunities to learn directly from people who are working in public health. So if you're interested in like the kind of stuff that they're presenting, that's a great time to reach out to learn more. Uh, and then I also would advise you to consider your peers, your classmates as future coworkers, because public health is a very small world. I'm only 3 years into my career and I've already bumped into classmates at like different practicums and workplaces. So I think it's a good time to build those connections, and it's genuinely really exciting to see where everyone goes.
Thank you, Krishan. I can also echo that public health is a very small community. Um, I run into people in the hallways here all the time who are either my TA during the program or were in the cohort ahead of me. So, yeah, definitely expect to see your fellow classmates within the job force. Sophia, what was your biggest takeaway?
Yeah, I was just gonna say that my biggest takeaway was how many different fields there are within public health. Um, I didn't truly know until I did my MPH. Every course I took kind of opened my eyes more and more with each one, from research to policy to ethics to environmental and indigenous health. There's so many places that you can be. So I really love that it's a path that doesn't really pigeonhole you into a very specific role for the rest of your life, and that you're able to kind of choose what best suits you.
Thanks, Sophia. Yes, there are so many options in public health. Even though it's a small community, it's a big field. So there's lots of different opportunities that you can explore. And Harsarat, what has been your
Uh,
biggest takeaway?
I think my biggest takeaway is to like ask for feedback whenever it's needed and to like ask for help. Like it's okay if we do not like know everything. I think like coming into the program, I had this mindset that like I need to like have all the answers, but I've like learned that just like being curious and like open to learning is really important. And like at the end of the day, you're a student, like you're here to like learn, make mistakes, and like grow along the way. And then I used to like be hesitant in terms of like asking for help, but I have realized that asking for like feedback is really important and really helps you grow. Like also getting other people's perspective not only helps you improve your work, but it can also like show you like different ways of approaching the same problem.
Yeah, I think that advice of asking for help and being curious and asking questions is great advice for life across the board. Not just here in your careers or in school, but that's definitely something that everyone should do more of. So thank you all for answering those questions. I'm going to ask all of the attendees now that if you have additional questions for one specific panelist or for all the panelists as a whole, or even for myself, you can go ahead and add that into the question and answer. I will open it up to the panelists, and if you have anything you want to add, um, please feel free if there is something that we didn't ask and you wanted to speak to, you can go ahead. Um, Otherwise, I will wait to see if we have any questions that come in. I know I'm sure a lot of you are currently applying for practicums. I think this is the time that everyone's doing that. So if you have questions about what that process looks like, please feel free to add them here. We have lots of experience with practicums on the call with us right now. And if any of you happen to be doing a thesis, I can provide maybe some guidance on that. I am one of the odd MPH students that did a thesis instead of a practicum, but I graduated many, many years ago. I'm not seeing any questions come in. Feel free to add them, but I am just going to keep going through the slide deck here. But please add your questions if you have them, and we will address them. If you are new to the NCCMT, or if you're fairly new and you're looking to get started, with your evidence-informed decision-making journey, we do have a few resources on this slide to help you get started. So first and foremost, create an account with NCCMT, and from there you can access a user dashboard where you can track your learning needs assessment performance, and you can try out the online learning modules and track your progress through those. If you're interested in other events that we are hosting, definitely subscribe to our newsletter. This goes out monthly, and we include details on all of our upcoming events, including workshops and webinars. We do have another upcoming webinar happening in November. If you are interested in the rapid review process and you're curious about artificial intelligence, we will be talking about how we use AI to conduct our rapid reviews that we do in collaboration with different public health organizations. So definitely check out that webinar. You can follow us on LinkedIn and YouTube so you can keep up to date with events that we are hosting, conferences that we are attending, as well as you will be able to find all of our previous webinar recordings on our YouTube page. And lastly, if you are interested in health evidence, definitely check out Health Evidence to subscribe to our monthly evidence service and keep up to date with new public health interventions. We have a question here, so I will read it. I am not looking for a practicum right now, but I will be graduating soon and looking for jobs. Do any of the panelists have any tips for post-graduation job searches? That's a very good question. Any of their panelists have something to address this?
I can jump in and I will be transparent. It took me quite a few months to find a job. And it did stress me out a bit at first, but I realized that there's a lot of stuff going on in public health. It's just sometimes difficult to find them posted in one place. Like I mentioned, I had a lot of success checking out like the specific organizations themselves, not just sticking to like organizations that have public health in their name, but maybe like smaller community organizations that do public health work will also have opportunities there. I found this job at the NCCMT, not on the NCCMT website, but in the McMaster University postings. So you might actually have to look into different like educational institutions and look at their job boards, and then they will have more details there about what is actually like health related. And then I found LinkedIn actually super helpful. Like throughout my master's degree, I just started adding all my classmates. And certain people you will find out are the ones who are really good at sharing different opportunities that come up. So I find that that's a good place to look to, not necessarily the LinkedIn job board, but like what people are sharing on their feeds can be super helpful. And what's nice with LinkedIn is usually, or sometimes, you can find out who is actually hiring. And you can ask questions directly to whoever posted it if you want to really express your interest.
Thanks, Krishan. Harsarat or Sophia, do either of you have anything you wanted to add?
I was just gonna add, yeah, like Krishan said a little bit, but networking is really so important. You've probably heard it before, but yeah, like through LinkedIn, I think is really helpful, even just reaching out to people just to ask questions, not even about specifically about job openings, but asking them questions about their organization, what they know, asking them for advice, anything like that.
Similar to like what both of them said, I think networking is definitely huge. I think just having these informal like coffee chats with like people can really like teach you so much different like about can teach you so much about the different roles that are out there and like the career path, and that's something that I'm also like doing right now. Like I'm also like looking for full-time jobs. I'm almost done with my MPH. And I think sometimes though like conversations can like also like lead to having good like mentors or even them connecting you to like different opportunities that you might not like know of. So I think it's definitely like worth taking initiatives to have these coffee chats with these people who you think who are like working in the field that you're interested in. They might like know about an opportunity that you didn't even know about. Definitely like networking is definitely big, I think.
Yeah, I definitely agree. Networking is important. Um, with that being said, I mean, if anyone is curious about working at the NCCMT or one of the other NCCs, please feel free to reach out to us. At our email address, and someone will get back to you, or at least try to direct you to someone who can answer your question. But yeah, I agree. When I was first looking for jobs as well, I reached out to people just to ask questions and learn, what does a day-to-day look like in your role, to kind of figure out what you wanted to do. So I think that's important. I have a question that I think is addressed here to Krishan. So I was curious about the Toronto Public Health Librarian. Is there any way to reach out to them about the mailing list, or are they mainly for employees?
So I think it was probably just mainly for employees, and it was like a COVID specific mailing list. So I don't know if it exists anymore. I think basically during COVID, a lot of public health staff were redeployed to different staff positions, like they had restructured the organization.
I don't know if it's just for me, but Krishan froze.
Am I back?
Yeah, you're back now.
Thank you. Sorry. My computer gave up. Anyway, I think I was saying that during the COVID-19 pandemic, staff were redeployed to different positions. So I think that mailing list is mostly like, hey, there's so many COVID studies coming out. Here's the new ones. Here are the newest info on the vaccine. So I don't think that exists anymore. But if you are curious about like librarian roles or getting in touch with them, I suggest you just check out some staff directories at different public health units. Sometimes you'll be able to see like specific roles and maybe a contact for the people there.
Thank you. Yeah, I think most, maybe not all, but most regional or local public health units do have a librarian. Um, that is available internally. If you are interested, though, in keeping up to date with new public health interventions, our Health Evidence Monthly Evidence Service is a monthly email that we send out every month, and it does contain a list of all the recent systematic reviews that were published that month. Pertaining to different public health interventions. So that is also a good way to keep up to date with new things that are going on in public health. Um, okay, I don't see any other questions at this time. Another thing I wanted to bring to everyone's attention is the NCCPH Knowledge Translation Graduate Student Awards. So this is an initiative that we collectively do with the other NCCs to support and recognize the efforts of different Canadian public health graduate students. And we offer this award every year. The award essentially recognizes graduate students or recent grads who are leading high quality, innovative, and impactful knowledge translation projects within public health. The applications for this award are currently open. We will be awarding three prizes of $1,500 during the Canadian Public Health Association's annual conference, Public Health 2026, which will be hosted in Montreal this year. The award winners, in addition to the monetary prize, will get to present their KT research projects to public health networks during the conference. So this is a really, really big change this year. You will get the opportunity to actually present to public health professionals. And this is a great networking opportunity. Where you can get your project out into the public health world and hopefully build connections for the future. So applications are now open, and the deadline is December 1st. So please reach out if you have other questions about the KT Student Awards, or you can visit the link on the screen to learn additional details. So as we wrap up in these last few minutes, I do encourage you to add any other questions that you may have for myself or the panelists. Krishan is also going to launch the post-webinar polling questions that we'll ask you to fill out. And like I said, these are very helpful for us to plan future webinar initiatives and sessions that we offer. I want to thank our panelists for joining today and sharing their perspectives on their MPH experiences and their work in the public health workforce. I also want to thank everyone for joining this evening or this afternoon, depending on where you are in the country. It's a very rainy and gloomy evening here in Ontario, so it is kind of a nice night to just be logged on and listening to this session. So hopefully everybody had a chance to learn something and are able to take away some valuable information that they can use throughout their MPH programs. We wish you all the best. And I don't see any other questions coming in, so I think we can wrap up. And if you do happen to have any questions, please connect with us via the email address on the screen. So once again, thank you to the panelists and thank you for everyone who was able to attend tonight. Okay, thanks.